Good evening, everyone, and welcome to our program this evening. My name is Justice Marguerite Grays. I am the co-president of the Judges and Lawyers Breast Cancer Alert, fondly known as JALBCA. I'm also the administrative judge for the civil term for the 11th Judicial District, also known as Queens Supreme Court. On behalf of JALBCA, welcome to tonight's program, Family Caregivers, Unpaid, Overworked, Underappreciated, How to Succeed Without Becoming Patient Number 2. Before we dive into the program, I just wanted to tell you a little bit about JALBCA. JALBCA is an association of judges and lawyers that was founded in 1992. This year, we are celebrating our 30th anniversary. JALBCA underwrites dozens of free mammography vans to provide uninsured and underinsured women in breast cancer screening in their own communities. We fund legal and other support services for individuals and families in crisis from breast cancer, which have been more important than ever during this COVID-19 pandemic. We also provide resources to members of the legal community diagnosed with breast cancer, including a new support group that meets monthly by Zoom. We present educational programs, such as this one, to raise awareness of medical and personal challenges relating to breast cancer and resources to assist patients and their family caregivers. Now, JALBCA is small but mighty. We extend our reach by partnering with our grantees, and we also partner with the bench, bar, and other breast cancer groups that help publicize our programs. To learn more about JALBCA, please visit our website at www.jalbca.org, or feel free to contact our terrific executive director, Claire Gunterkeist, and her information is also located on our website. Now, for tonight's program, JALBCA board member and distinguished elder law attorney, Peter Strauss, has spearheaded and he is moderating the program. Peter will introduce the panelists, and their full bios are available on our website. I just want to thank Mr. Strauss and tonight's speakers for presenting this important program. And many thanks to the law firm of Pierro, Connor, and Strauss, LLP, with special thanks to the voice you just heard, Ms. Beth Wertman, the firm's Director of Marketing and Business Development, for handling all the registration and assisting us with the Zoom webinar technology that we are all using this evening. Now, one final plug before I turn it over to Peter. We have two upcoming and very exciting programs. One is next week, next Wednesday on February 23rd. It's our second program for caregivers, a performance play. And the play is entitled The Actual Dance by Sam Simon, one of our fabulous panelists this evening. Also, on March 15th, please join us for our 25th annual Ellen P. Hermanson Memorial Symposium. That symposium is entitled, What's All the Buzz About Alcohol and Breast Cancer? So without further ado, thank you again for joining us. I turn it over to you, Peter.
Thank you, Judge. It's been a pleasure to work with you in putting this together and for introducing the program and for your work when you're free from the bench to support JALBCA and its causes. So I'd like to just quickly welcome you again and introduce you to the speakers who you will hear from tonight after I just make a few introductory remarks. An old friend of mine, Reverend Greg Johnson, a distinguished career, and he was a very important interfaith minister for family caregiving and is the chief advisor for family caregiving and office of CEO at EmblemHealth. So he's he's turned one of our major insurance companies into something more than just paying your insurance bills. I'm also so excited to have Sheila Warnock, who I've known for many years, who is the founder and director of ShareTheCare, and you'll hear more about that later. And then, as Judge Grays has mentioned, Sam Simon, the author of this wonderful play that has been shown around theaters in the country for many years about his struggle as a caregiver. And Sam will give us his thoughts about his experience. And just as the judge said, next week, we will show you, starting at 6 p.m., a week from tonight, a video of the play, followed by talkback where I will interview Sam and his wife, Susan, who is the patient in the caregiving struggle that he went through successfully, fortunately, and we love Susan, and we'll hear about his journey. So I want to just give you a little bit of background, and at the end, I'll come back and give you a few more comments. But the background here for this really serious issue is the growing New York State, 65 and over aging population. And you'll see from 2019 to a few years from now, 2030, we're almost there, a significant increase in the number of people over 65. And the over 85s, the old, is the fastest growing segment of our population in America. And you can see the dramatic rise here in New York State. So this is part of the background to the subject we want to talk about tonight. This slide just shows you the number of people who are dealing with this problem for caregiving for over the past 5 years. And you'll see all these slides if you want later on your own screens. You can rewatch the video, but it's dramatic and it's growing tremendously. So that is the background. And of course, the impact of COVID-19, I mean, families have really been thrown into crisis. Services are harder to access. Adult daycare programs have been shut down. Home care access is limited because of the shortage of caregivers, paid caregivers. One, they're not being paid enough, and two, they're masked, they're home, they're not working. And the inability of many caregivers to visit family members, their loved ones who are hospitalized, nursing homes, assisted living facilities. You all know or have experienced the inability to see people perhaps for a year, and doing long distance caregiving. And we don't know how long this is going to go on. For those who work and need a paid caregiver, these numbers are astounding. And the most important, I think, is the lower left. 23% of jobs available for home care aides are being unfilled. And this is for many factors, but it is a significant problem, particularly upstate, not quite as bad in New York City, but it has a dramatic effect on the ability to accomplish the goal of caregiving. So for those who have to pay for care, these numbers are dramatic. This can wipe out a family, and we can talk about this later, but upstate, a full-time home care aide can cost $192,000 a year. Who'd have thought? And in metropolitan New York City area, we could be at $215,000, $216,000 or even more. We are literally wiping out middle-income American families because we're not doing the job right. And you'll hear more about this later. So I'm going to turn it over now to Reverend Gregory Johnson to talk about his perception of this area and get us into the challenge of tonight. How do we prevent the caregiver from becoming patient number 2? Greg, it's a pleasure. It's all yours.
Thank you. Thank you, Peter. And it's wonderful to be here this evening with all of you. And I want to thank you, Peter, and I want to thank Beth from your office for her wonderful work. And I want to thank you for introducing me to JALBCA. One of the most enjoyable evenings I spent, and I say it to those of you who are online, was with your committee. And I am going to put my brief remarks based around that wonderful conversation. And also, it's wonderful to be with two of my best friends, Sheila and Sam. We have been privileged to speak in many, many places together. But let me begin this way. Wherever in the world I'm invited to speak, I begin the same way, by simply saying, I've come to say the two words that family caregivers rarely, if ever, hear. And if you remember nothing else I say tonight, please take to your heart, thank you. Thank you. You are the backbone of the world's healthcare systems. Yes, you're distinguished lawyers, distinguished judges, and guests from many fields who are with us in this incredibly wonderful response to the program. But whatever your professional life is, as a family caregiver, you are doing something that is so needed, and you have become the backbone of the world's healthcare systems. It's family caregiving that truly unites the world. I'm privileged to see that because I travel internationally and have, not for the last 2 years, but I have done it in these last 2 years by this wonderful vehicle called technology and Zoom, and for which I am endlessly, endlessly grateful. When I was first invited by EmblemHealth, and I'm deeply grateful for them, for in truth, they gave me the ministry of my life for the last 22 years. I was invited to bring attention to the third leg of the healthcare stool. And I want to just begin with that because it's something that we need to look at. With the brilliant work that you as JALBCA have been doing, you have been focusing very much on the care recipients. But in the drama, as it were, of healthcare, if we were going to do a play, we'd need 3 actors. We would need a care recipient, someone who is ill physically, emotionally, or spiritually. And we know that when we're challenged in one area, it relates to all of them. So that first leg of that stool is the care recipient. The second leg are the professional caregivers, meaning persons who are paid, from the highest paid doctor to the very underpaid home care attendants. Those are the paid family, the professional caregiver is what we refer to them. The third leg is traditionally the unpaid family caregiver, and that can be family of origins and families of choice. We need all 3 legs working together to hold that stool. And for a very long time, much of the focus in healthcare had been on the care recipient and on the professional caregiver. And when Emblem's chairman came to me at that time, and the chairman of the foundation, they said, we want to bring attention to the often silent patients. And that is the theme of tonight's program. And it's the reason I begin here. It is the silent patient, often the family caregiver. And let me show you an example. What happens? You're a wonderful woman. You're at home. You're caring for someone. The doorbell rings. You open the door, and the person standing on the other side says, how is he doing? You don't exist. And too often in caregiving, the caregiver, the family caregiver, recedes and recedes into isolation until, instead of being able to give from their abundance, they're struggling to even live. So when I was asked at that very first luncheon when we were discussing this, and these were 2 friends of mine, they said, what would your mission statement be? And I said, well, quite frankly, first of all, at that point, I knew nothing formally about family caregiving. because other than what I had done. And I knew it from a minister's point of view. And I certainly knew nothing about insurance. Well, that I certainly have learned. And I'm very grateful for that. But as a minister, and this is what really excited me about this invitation, I said to the two of them, I said, you know, it's quite interesting to me. And I'm grateful for the attention that you want to bring to these silent patients. Because as a minister, I have buried more caregivers than care recipients. Yes. And that remains true because it's been my life's work and ministry, as it were. So I'm not the perfect example on that, but that was the point. We want to keep caregivers caregivers. That's the mission statement. Keeping caregivers caregivers, not creating more care recipients. Now, what is a family caregiver? The brilliant Dr. Carol Levine from United Hospital Fund, her first book on family caregiving, and she's been the patron saint of this entire industry. Carol's first book was, and it was based on her life experience, as for each of us that you're going to hear tonight. We've been caregivers and we come from that point of view. But the title of her book, and it defines a family caregiver, it is someone who is always on call. And it never happens between 9 and 5. You know that. It happens when you got to push buttons and find things that drive us crazy, certainly me. And then another definition that Carol has used, and I use it very quickly with you. What is a family caregiver? It's someone who shows up and stays to help. Now, that's the hard part. It's someone who shows up and stays to help. Rosalind Carter has probably said it better than anyone. Since leaving the White House, Mrs. Carter has been very active with the Rosalind Carter Family Caregiving Initiative down in Plains, Georgia. I had the privilege of being there on several occasions and speaking there. And Mrs. Carter has a phrase for which she's well known all over the world, and I love it. She says, in life, there are really only 4 types of people. There are those of us who are family caregivers today. I'm one, and I know many of you are. There are those of us who have been family caregivers. There are those of us who will be caregivers. And there are people like me. I'm a multiple stroke survivor. There will be those of us who will be cared for. And before we leave this planet, most of us will play each of those roles at some point. And so it's extremely important that we understand what that role is. In family caregiving, there is really only one rule. There are not too many areas of life where there are one rule. But that rule is, before I can care for you, I've got to care for myself. Before I can care for you, I've got to care for myself. I can't say to you, lean on me and we're both going to fall over. No, I need to be able to give from my abundance so that together we can walk this journey. And this item that I'm now going to share with you came very much from the conversation I had with the committee of JALBCA, the Caregiving Program Committee. Our name is family, whether it's family of origin or family of choice, that's a whole lecture in and of itself. But we have many different types of families, each and every one of us. Caregivers is the second word. We are not cure givers. And for an organization and for people who are so frequently involved in wanting to learn the medical things, and all of that is extremely important, and it's part of the caregiving journey. But we are caregivers. And what does that mean? That means I accept today, at this moment, the present situation. I'm not going to plan the funeral. I'm not going to say, why didn't we do this? You never get anywhere saying why anyhow. The question is, what is the situation at this moment, and how can I help the care recipient, whom I know by and large better than the medical staff and better than anyone that they're dealing with, because in many cases they are a loved one. But I need to learn the gift of acceptance, that this is the reality. And then I can begin to learn all these other things, but I can be a vital part of the team, because I need always to remember that for all the fear, for all the confusion, for all the shock of suddenly becoming a caregiver, the care recipient's going through that too and may not be able to communicate. So I need to be that stabilizing, loving presence that says, we'll walk together. I'm with you now. So I would urge you to please check into that very carefully. Also, as we spoke, and I have only a few minutes, so I want to say this to you because I was so impressed. As we talked on and on at that wonderful meeting, suddenly people began telling their stories. There's nothing like stories. And this one's experience in caregiving, and this one, and their loved one. And then they began to see the bigger face, the many faces of family caregiving. Someone said to me, you know, my law office, we're a family. Yes, you are. How does family caregiving play into the workplace? We at Emblem are doing a great deal of work on that because we have successfully implemented tools and resources within EmblemHealth. We are now going into other corporations and helping them to help the caregiver to be the full person whom they are. I live in Manhattan. I'm speaking to you from my home in Chelsea, 21-story apartment building. I have a family caregiving committee that I started here probably 18 years ago, because whenever I get an idea, I believe in trying it out. It's not failure. It may not work, but we'll see. Well, this became a Know Your Neighbor committee in very appropriate manner. But we have, in crisis times, been able to get people out of the building when we knew electricity was going to be going out, because we knew who was on what type of equipment, and we were able to help them. We also knew when people were away and airports were blocked down, someone had a pet that no one was taking care of. The committee stepped in. That's family caregiving, because we were a family. At my church, I've served for many years. I'm now retired from the Marble Collegiate Church. We started a caregiving support group because so often, folks, there are support groups for breast cancer. There are support groups for diabetes, for heart. But for people who have other diseases, there aren't support groups. So I call them a non-disease specific support group. There are many, many other opportunities. Now, I'm going to ask Beth, can you share 2 quick slides with me before I pass the baton? She's going to just share this with you, and you will have copies of it in the program so that you can use it later. And we're moving. There we go. May I see the next slide? Yes. This is a brief comment on family caregiving for you and a copy of a book that I wrote for the White House Conference on Aging. It's now available from EmblemHealth in English, Spanish, and in Chinese. And the next slide, please. And our resources from EmblemHealth are all listed. And then this is a group of programs that I do as Greg Johnson Partnerships International. We are blessed to have an international following. I do them weekly. The website for my corporate entity, which is Greg Johnson Partnerships International, I'm found on Facebook under Gregory Johnson, and our YouTube channel has hundreds and hundreds of programs. Family caregiving with the Rev. And just recently, I'm getting very modern with Instagram. No, I'm surrounding myself by people who can. So I want to thank you for this opportunity just to say hello, to say thank you, and I hope to set the stage for 2 incredible people. And now, thanks to Peter Strauss, I met the lady whom I'm about to introduce to you, the incredible, the woman who has blessed people all over the world, and wherever I travel, people say to me, "Do you know Sheila Warnock?" And I do indeed. Sheila, it's all yours.
Thank you, Greg. Thank you for that introduction. I'm very honored to be part of JALBCA's program this evening, and working with some friends like Sam and Greg. But I am here to talk about caregivers, a subject of which I know a great deal. Caregiving is the toughest job in the world, quite frankly. It really, really is, and I can attest to that. But it comes upon us kind of like a sudden emergency. It's a difficult diagnosis. It could be an accident. It could be some kind of crisis, is usually when caregivers end up being a caregiver, and they have no time to prepare. They're in the lion's den right away. So I just want to share my screen with you in a moment. But the thing that happens in the beginning is your friends, your neighbors come by, they say, "Oh, I'm so sorry to hear about what's going on. You know, call me if you need anything," or "let me know how I can help." And then they leave, and then the caregiver is there by themselves. And what happens? Nothing. Crickets. That's because the caregiver doesn't want to impose on anybody, doesn't want to take away their time, and also feels they could never reciprocate if somebody helped them. And the people that have offered their help go away, but they're not going away because they don't care. They just don't know what to do. They don't know what to say. They don't know where to begin. And so we're left with this place that's really terrible. Nobody teaches us how to be a caregiver. That's really the crux of it. We don't learn this in school. We don't learn this. We learn on the job, and that's a problem. And that's one of the things that my work with Share the Care is trying to change. So I'd like to share my screen with you and take you on a journey. Whoops, came too far. No one teaches us to be a caregiver. And like I said, we learn on the job, but there is a solution, and that solution is Share the Care, because it's a plan of action that has been working for 25 years for people all over the US and 21 other countries that we're aware of. It's based on collaboration and teamwork, because if anything can change the world, it's a group of people who are like-minded and want to do something. And it allows them to be able to give emotional and social and practical support to somebody, whether they're at home or in the hospital, at discharge, during transitions into nursing homes or assisted living, where your group can go with you, and all the way up to end of life. And this all came about through personal experience, like it usually does for people who are in the position of talking about caregiving. For me, it started in 1984, when there was absolutely nothing on earth to help caregivers. No organizations, no books, no nothing. So I found myself to be my mother's long distance solitary caregiver at that time. And it was one of the toughest times of my life. My mother lived 5.5 hours away from me, upstate. I'm in New York City. My father was deceased and my brother was in the State Department and he lived in Japan. My friends didn't understand what I was beginning to go through with my mother because their parents weren't at this stage. I had to quit my job because I was a freelancer, and you can't be a freelance anything if you are a caregiver. So I had no income. I had to hire nurses' aides 3 days a week, 4 days a week, and I was there the rest of the time with my mother, but I was running back and forth. It was exhausting. And finally, I moved her to a retirement community where she went downhill very rapidly. And then I had to resort to a nursing home. At the same time, this is going on because caregiving doesn't come conveniently. My best friend, Susan Farrow, a divorced working mom with 2 young teens, found a lump behind her ear that turned out to be a rare terminal cancer of the parotid gland. She went in for surgery and radiation, and then she went back to work. All her friends knew about it, but what they didn't know was that over the 4 years, I'm the caregiver for my mom and trying to help Susan emotionally whenever I could when I was in town, that her cancer came back several times and had metastasized to her skeleton. So she had bone cancer. She reached a point, which happened to be just at the time I'm putting my mother in a nursing home, which is a low point in my life. Susan has a crisis. She's going in the hospital to find out if the cancer has reached her spine and she may not be able to walk. Fortunately, she was seeing a therapist, a brilliant therapist, Dr. Suki Miller, who was doing a lot of work with people who were terminally ill. And it was she who said to Susan, call your friends, get them to my office tomorrow night, and we'll figure out how we can help you. So Susan finally broke down and called 15 friends, and 12 of us showed up the next night on less than 24 hours notice. I will never forget that night as long as I live. I walked into the room and I looked at all these faces and I breathed a sigh of relief. Thank God it's not just me anymore. My co-author, Cabby Capicella, arrived terrified because she had never taken care of anyone in her entire life. Excuse me. Not even a pet. So she didn't know if she was going to be up to it. Everybody in the room had a certain kind of emotion going on. But then Dr. Miller asked Susan to please tell your friends what's going on with you. So she explained the situation and how terrified she was. And then she cried. And then we all cried. And then we all rolled up our sleeves and went to work. And by some miracle that night, the 12 of us came up with the key system for Share the Care. And we called it the rotating captain system. There were 12 of us. So if we worked in teams of 2, that meant we had 6 teams. And we always had 2 people because if something came up in the life of one person, there was always another one to keep the ball rolling. And we started in the next day. The job was to go to Susan to find out what she needed so we could call everybody else, get the jobs filled, give her a schedule of who was coming when to do what for how long so she could relax. Then we would rotate the next week in with a new team, fresh team. And the other thing was that Susan never had to ask for help. And we never burned out working this way. We started in the very next morning. And I was a captain with one of Susan's friends from work. And I have to tell you that even though I had never met this woman before, we started off at a level that was incredibly powerful because I felt like I had known her all my life because of the meeting we had the night before. And then we started working, and for the next 3.5 years, we did everything under the sun, moon, and stars for Susan, including taking her to the Bahamas for an alternative cancer treatment, to every kind of appointment, anything she needed, we made sure it happened. But our greatest accomplishment came just a few months before Susan passed away. Her youngest daughter was now graduating from college and was going to get married. So under Susan's supervision, the Funny Family, which is what we became known as, Susan's Funny Family, organized the wedding, soup to nuts, just like Susan would have done should she have been able. And it was wonderful. And she saved up all her energy to be there that day. And I'll never forget the beautiful bride thanking her parents for this wonderful wedding at Tavern on the Green, and thanking all her other moms for making it happen. Because we were moms, we were a family. And when we lost Susan, we knew we had done a good thing, but we had no idea how good until a few months later, when Cappy and I, who worked in advertising as a creative team, were working away on something and the phone rang, and it's this woman, Francine, and she says, "You don't know me, but Susan used to talk about her funny family all the time." And she said, "I'm like Susan. I'm divorced. I have non-Hodgkin's lymphoma. I'm about to have a bone marrow transplant. I only have an elderly mother and a young daughter. They're not going to be able to take care of me. Do you think I could have a funny family?" So Cappy and I looked at one another and said, you better believe it. We called our team together to meet with her 20 friends that wanted to help her, but they had no idea how to get started. And it was an enlightening meeting, because as these 20 people came in, and there were men in the second group, we could see them. They looked like we did the first night of our meeting. They were skeptical. They were nervous. They were, "Oh, what's going on here?" But as we talked to them and explained how we worked, how we shared the responsibility, so everybody felt like they, did everything they could and felt that they had shared the workload, we could see them begin to relax. We could see them kind of thinking, "Oh, this is organized. Oh, they have forms. Oh, they have a system. Oh, they have 7 principles. Wow, we could do this." And the room was filled with enormous love for Francine. And before you know it, they were running out the door, ready to start their own meeting to help Francine. That next morning, I called up Cappy and I said, "Cappy, did you see what happened last night? We have to put this down on paper so nobody has to reinvent the wheel." And that was the birth of the Share the Care book, How to Organize a Group to Care for Someone Seriously Ill, published in 1995 when there was nothing like it. In fact, I think Mrs. Carter's book came out only a couple of months before ours. So we were at the forefront of the caregiving world there. And then it started spreading grassroots style all over the place. We kept hearing about more and more groups, and it was really wonderful. And then the next thing I know, if I fast forward to 2002, something very dramatic happened. Cappy's father was diagnosed with a glioblastoma grade 4, and within 2 weeks of that, Cappy was diagnosed with a glioblastoma grade 4. This was shocking beyond the beyond. She opted for brain surgery rather than anything else. And I put together a Share the Care group with 33 people. And we needed 33 people to care for Cappy and run her life, because she was totally helpless. She couldn't speak, write, walk, or move by the end of 10 months, when both she and her father passed away within 12 hours of each other. It was like a lightning bolt out of the sky for me that this was time for me to give up my advertising career and get Share the Care out there in a bigger way. So I started the organization in 2003. And the first thing I did was try to talk to caregivers. And I would have the local community center would be holding an event where I could go and speak to caregivers, but caregivers didn't show up. There was like nobody there. So I had to find a different way, which I'll talk about in a moment. But the very next thing I did was to update the Share the Care book in 2004. I added 50 more pages based on the work Cappy's group had done, because it was really quite intense, and my informal research with other groups using the model and their ideas. And So the way I got around the fact that caregivers are too exhausted to come to listen to me talk about Share the Care and how it works and all of that, there's no room left in their brain. They're so on overload. All I had to do was remember what I felt like as a caregiver. So I developed a curriculum to teach health professionals so they could introduce this model to their patients and families that they see in the field every single day. So we do keynotes, a special training that's accredited by the Nurses Association, and all kinds of presentations all over. So this is how we get the word out. Key facts about Share the Care. This is very important. We do not start groups for people. I do not teach professionals to start groups. We teach them to introduce the model, so we empower the caregiver and their friends and coworkers, acquaintances, faith community friends who come together to help with a way to do it themselves. So they're not dependent on anything. They're running their own caregiving work. This is our current website. So if you go to it, you will find everything you need to start a Share the Care group, including links to purchase the book from Amazon, or also download all 23 Share the Care forms. There are some handouts that give an overview of how this gets started, as well as tips for the early weeks that a group is working together, even down to creating an emergency plan when something happens, what to do. So it starts with two friends. Two friends are the ones who will read the first 9 chapters of this book because it is written to them, so they can work with the family to figure out who to invite and what kind of help do they need. And they will manage and run the first meeting because it is entirely scripted. They don't have to make up anything. It's all laid out for them. And the meeting is based on our first meeting and all subsequent meetings for the last 25 years. So it's working. You just pick up the book and make it happen. People get to choose their level of commitment, and nobody has to do a job they don't feel comfortable doing. That's very key. So the group meets. They learn who everybody is, what they do for a living, start to uncover talents and skills. They learn about the Share the Care systems, and they leave with a plan of action and a sense of commitment. This is the heart of what Share the Care is all about. Nobody else does anything like it. The guidebook continues to help them uncover more skills and talents, how to share jobs, how to work through group problem solving, also how to face your own emotional issues as a caregiver. The 7 principles are in there, and they keep a group going, and those principles are in the handout you can download from our website. Also signals when another meeting is needed, and that comes when there's been a dramatic change in the care recipient. They're getting better, or they're moving closer to end of life. And so the group needs to adjust how it's working and what they're doing to meet those needs. And also a closing meeting is very important when the need has gone away. Groups are made up of everybody. This is not about a certain type of, everybody has something to give. And this is not about us against nurses, aides. We're all in it together. Everybody who's helping this person and this family and this caregiver, we're all in it together. And don't forget about people that live in other states or other countries even. They can help through the internet. And people who have their own health issues oftentimes want to have a purpose and want to be part of a group, because there's a magic about a group at work that makes people want to have a piece of it. And from our perspective, student nurses and people who are studying to be social workers can really learn a lot by participating in a Share the Care group. It is also very interesting to me that this started for a cancer patient. Today it has evolved to work through anything even keeping a business going, work through anything through the entire life cycle, from a difficult pregnancy all the way through end of life and bereavement. So older adults living alone who just need some assistance, this is a great way to support them. Grandparents raising small children, et cetera, et cetera. So the model works to do anything with a group of people. There has been a study, it was published in the Journal of Gerontological Social Work in 2016. It was a study that consisted of 134 caregivers, care recipients, and group members from the US, Canada, Australia, and representation from the UK, as well as Hong Kong. And in a nutshell, Share the Care study shows that the caregiving preparedness of the group members, makes them effective teammates and future caregivers when we're going to need a whole lot of caregivers, especially with COVID and long haulers and the aging population. This is a serious thing, and we need to bring back kindness and helping each other. This is the most important thing one can do in terms of getting the world back in good working order. Share the Care supports the care receiver's ability to stay at home with necessary informal systems in place. It's replicable, its functionality can be applied across settings anywhere for any circumstance. It ensures the longevity and the successful caregiving experience because of its structured system of care. That makes all the difference in the world. This is not loosey-goosey, this is very structured. It helps reduce the burden on the caregiver, of course, and has a positive impact on everyone involved. As one of the people in the study mentioned, the caregiver said, she was better able to balance caregiving with other responsibilities. Without the group, it would have been nearly impossible for me to continue my employment while taking care of my sibling. Yes, having a group help you. This quote is similar to ones that I hear all the time. It was the most rewarding experience of my life, believe it or not. It proved that I could contribute so much without feeling overwhelmed or overburdened. It taught me to trust others and to know the real meaning of teamwork. Emotionally, being able to choose to help according to my strengths and to pass the buck where I felt weak was a godsend. So, Share the Care is ripe for replication. It's low cost, it's adaptable, it's sustainable. You don't have to qualify for anything. You don't have to be a certain age. You don't have to pay for anything except a couple of books. And it addresses some of the multiple policy objectives that are going on now. It decreases caregiver burden and social isolation. It will better prepare communities to meet the challenges of an aging society and a COVID society, and to improve end-of-life care. So on that note, I'm just going to show you my contact information, which will be available at the end of this whole event. You'll get everybody's, but I really urge you to please go to our website and really explore it. We have sections for caregivers and their friends, health professionals, faith communities, as well as corporations. So there's many videos and a lot to look at, and I hope that you will consider opening your heart to letting people help you because they want to, if they have a way of doing it that is organized, makes sense, and that is heartfelt. We want to bring back kindness. So I'm going to go back and stop sharing so that I can introduce to you your next speaker, who is Sam Simon of the Actual Dance fame, and hear his inspirational story of caregiving that's all about love. Over to you, Sam.
Thank you very, very much, Sheila and Greg and JALBCA, for having me. And I want to let everybody know that there is a dance. to dance that one day, each and every one of us will dance. And this dance takes place in a grand ballroom with a fabulous orchestra. The orchestra, I think, actually plays whatever song that the dancers themselves want to hear. And even though I've been to so many of these events, I don't think I can actually recall a single tune ever played by one of the orchestras. So you can attend one of these events as a guest of the dancers, or you might just end up in the gallery watching as someone you know and love is dancing. When it's my turn to dance, I want to dance with the person I have loved most in this world. For most of my life, I was just another person. Actually, as I got into my work in Washington, my son called me a minor celebrity. I had a law degree. I went to work for Ralph Nader in 1970, one of the first people ever to work for him. And I was by the way, I was on working for Nader. I had a public affairs firm. I even was on some of the big television shows, Oprah Winfrey once. So I was busy working. It was the spring of 2000, and as a usual busy guy, I walk in our garage. It's late in the 7 o'clock at night, spring of 2000. And I just keep moving along. And I say to Susan, how was your day? Remembering that she had her annual physical that day. And she said, everything's fine, Sam. And then started to leave and say, oh, by the way, my internist wants me to see a surgeon to check out something she felt in my right breast. Now, Sam, she didn't think it was anything to worry about. It just felt funny to her. And I have never been the same since that night. I finished a career and I sold a company, and I'm doing something now that I never believed I would be doing, because I had an experience that I could not have imagined. And it is my privilege to articulate that experience both in a play and now in a book. And I learned from my experience. Now, the details of it are all listed are all in this play and more detailed in the book. But a couple of things I learned. Now, the deal is, and I think it's important for you to know that when it all started, Susan and I had been married 34 years. Her mother had passed away from breast cancer at the age of 56. Susan, when our journey started, Susan was 54. Now, Susan never gave up. And as we went through this journey, you will hear, if you come next week and watch the play, that the doctors by and large did at some points. The news would be good, then be bad, then be really bad, and then really, really bad. And I had a job. My job, in part, was Susan said, I don't want anybody negative around me. Just want you to think about that. We've been married 34 years. I was convinced she was going to die in my head because her mother did. My mother died of metastasized breast cancer. I had it. I knew what was going to happen. But she insisted that nobody be around her. And so this is 2022. Just this past year, I figured out another key to my experience. I never quite understood why it took me 9 years to write this play. And then It's been another about 4 or 5 years, or actually took me, I'm sorry, yeah, it took me 9 years to write the play, it took me 3 years to get it all done, and now it's been another 9 years that I've been performing. Actually, it's, correct myself again, 11 years to write the play. But why did I never understand what it was that, why I took so long to begin to tell the story? And I realized that a caregiver, a love, and I'm going to get to this because I have a new word for you, a love partner. After 34 years, her intimate partner, 2 children, she couldn't sniff out that I had given up on a good outcome. Not that on her, on a good outcome. And, you know, I realize now that I had to push it so deep inside of me that I couldn't even admit it to myself. Even though I was aware of it, I couldn't open up to it until, and thanks to theater. And I did improv theater, and I did look with a good group of supporters, able to write a play that I have been able to perform. And every time I perform it, by the way, the most important feedback is from the audience, and they let me understand that I was not alone, and my experience is not unique. But I want to make a point here, and then I'm going to try to articulate a bit more of how I felt. And by the way, I did perform the full show live for JALBCA, I think it was about 5 years ago. And in that, every time afterwards, usually it's Greg Johnson who moderates the call. This time we had a psychiatrist, an oncological psychiatrist from Sloan Kettering moderating the play. And this is not a brag, but she said, you know, I got to tell you what Sam did, what he describes. As a psychiatrist, I would say he did it all right. He did everything he needed to do. The things I did, looking for help, how I looked for the help, who I went to, you have to see the play to know it all. And I didn't know, I didn't do it with intention. I was desperate. Why was I desperate? Because I was going to lose the person I loved most in this world. And my show is what I call the love partner journey. So yes, we are all family caregivers, and all the information you just received is absolutely right. And there is another half of that journey, and I do this because I've come to believe that as a caregiver, that I wasn't simply giving care. And there are scenes in the show where I hold out the semicircular pan for Susan to throw up. I steady her. She goes to the bathroom with the IV stands. And that's giving care. I cared for her. I know I cared for her, but I gave care. And my heart was breaking. I was dying inside in my own sort of way. And that was the hardest part of the journey for me, is how was I going to do this? And that's what drove me to ask for help from a rabbi, which didn't go all that well, which landed me in the office of a psychiatrist, which part of my journey was to experience an ecstatic moment, to see and imagine myself in a ballroom surrounded by everyone we'd ever met, ever known, ever loved in the world, ready to watch Susan and I dance a dance where our last dance, and she would disappear from my arms. How do you do that? Now, I've learned that I describe that role, that unique role, that needs its own supporting care as a love partner journey. It is distinct. It is the other half of what many, many people go to. As you've heard, you're unpaid, you have to take care of yourself, as Greg says, you need a team, and you have to understand the emotional side, and that there is a gift in the privilege of helping somebody you love as they go through this. Now, the book is a memoir, takes us from the day we met. We didn't even meet. We noticed each other until that moment when I expected Susan to literally disappear from my arms into a unknown, into a bright light, if you will. Now I'm going to take my last few minutes. And this is the preface of my book. And if you hopefully you might come back to watch the full show on the 13th, I believe it is, and you get a chance to get the book, you know, it's available on all the platforms. It might help you understand the play a little bit better, but I'm going to read the preface. It's funny, you write something and you don't always know and remember writing it. And this is what I had to say, that to the reader of the book, that as you move through the book, and if you watch the play, I hope you will suspend disbelief. Let go all of your assumptions and discover for yourself places of boundless love in your life. If I could, I would whisper in your ear from time to time, as you made your way through those pages or as you watched the play, I would gently assure you, yes, it's true, it exists. The places, the moments, the love are all real. The story in every moment in the play and in the book did happen, every moment. You will learn that all the details of two young people who meet, fall in love, and grow up together as a married couple. Now, this part of the story is familiar, maybe even mundane, though I hope I made it engaging. It, though, it is something else. It is a different place in time and in space in which I travel seamlessly and simultaneously as I stand on the edge of the abyss. This experience suggests an answer to how I came to terms with the anticipated loss of the love of my life, Susan. As my whispers would assure you, the book and the play is not fiction. The memoir stems, as I said, from the actual experience. The paranormal moments are real. They're not products of my imaginations. I experienced them. The story itself will have a familiar ring. Many books by men focus on their caregiver role for someone, perhaps a wife, husband, and friend with cancer. There are also many books about the end of life journey with a loved one. I believe this book is a little different. It defines a new and different role, the role of love partner. And the love partner is a person whose heart and soul, as I said, is breaking during the experience, the loss of the beloved. In this role, we're not a nurse, we're not giving care. And they are certainly important. Maybe the best way to describe or explain this, and perhaps you will see it as you read or watch a play, I am both a caregiver and a love partner. How do you hold the person you love most in your arm, most in the world as they take their last breath? And how do you help your wife as she becomes sick to her stomach and when she requires to have an injection every day? Those are the two roles. They're distinct, they're clear. Through this journey, I came to understand what love really means. Because I use the word, I understand it is to be about a spiritual connection with another human being. It consists of knitting together over time the essence of two individuals into a singular spiritual unit. One might argue, and I do, that this essence is part of a shared soul. And I will end with a poem that I wrote that I think is the anthem of the play. It's called Us. And it goes, us. Life exists in each of us as a form of the divine, a tangible essence of who we are. Love is when our essence became entwined, each an equal half of the other. I love you. simply awakens the us in you and me. I love you. I love you all. I love particularly Greg and Sheila and those of you who work as caregivers and work to spread this message. Please, if you can, join us at 6 p.m. next Wednesday. You already had the spoiler alert. Susan is alive and well and will be with us, and you can register on this line. So with that, I turn this back to Peter. And again, Peter and JALBCA, thank you so much, and to my fellow panelists, and for all of you who've come to hear our stories.
Sam, thank you so much. Sheila and Greg, I'm very moved by what I've learned tonight, heard tonight. And it almost makes me want to close the evening. But I'm a lawyer. Lawyers never stop talking. And I'm a lawyer who deals with problems of aging and dying. And so I have seen my clients do the good and the bad as caregivers and suffer as caregivers. So I want to spend just a few minutes before we take some questions, or I ask some, to tell you that what I do, I think, is give caregivers and patients a platform to be free and enable themselves to be better caregivers. Caregivers need the tools to be able to do their job. And I almost hesitate to talk about legal things, but I need to explain the platform. All of you who are caregivers need to have those legal tools so you can access whatever financial means you have to pay for perhaps private aids or support yourself, take respite trips, travel, give yourself some space. And those legal documents deal first with financial management and secondly with healthcare decision-making. As far as the healthcare decision-making you see on this screen, we call this all advanced planning or advanced directives. You need to have your loved one's healthcare proxy because there will be times when that person will not be able to make decisions for themselves. Very simply, you're appointing a representative. You become the representative, but that representative, your duty is to act in accordance with the person you're caring for, his or her wishes. It's not always to decide what you think is best. So that's what we call the healthcare proxy. The living will, which we prefer to call in our firm a healthcare declaration, because that's really what it is. It's the patient's expression of wishes about the kind of care and treatment they would want or forego during the process of caregiving leading up to the time of death. It guides the agent, it guides the caregiver. So when hard decisions need to be made, they understand that it's your loved one's wishes about what you're deciding, not playing God, deciding what you think is best. There is a new form that's become popular in America called the MOST, a medical order on life-sustaining treatment. It's usually better than a lawyer's words and documents. It's done with your physician in the hospital setting, and it becomes a medical order, so it has more power, more authority. If you don't have those wishes, those documents, by the way, New York has a law called the Family Healthcare Decision Act. So with the priority of persons, first your spouse, then your children, then your siblings, that person can make decisions based on certain standards written into the law. So it's not a total loss, but it's better to have your own documents that you've thought through carefully with the patient. And then there's the finances. your spouse, your loved one, your partner may have the money, and that's the money that's going to provide for the extra care that you may have to buy that isn't covered by your Medicare, which, by the way, doesn't cover long-term care. So you have a power of attorney. That's a document where you obtain a written authority to manage your loved one's finances. And you should always have a successor. By the way, you should always have a successor healthcare agent as well. So I don't want to go into the details, but that's really important. And just finally, I want to say this about the legal stuff. Suppose your loved one has dementia, maybe has many strokes, maybe has moderate Alzheimer's disease. Is it too late to have that person execute these advance directives? No. Capacity is very task specific. You may not be able to understand some things, but you may understand others. And we do careful analyses of the client's ability to understand. And you know, you can go on our website or call me, and I'll tell you whether you can resolve this issue. But don't assume it's too late. Act now. Get those things done. And if you don't do all this, and you need to access your loved one's assets to take care of him or her, you might wind up in the guardianship court. You don't want to do that. It's public, it's slow, it's invasive. Do that planning when you're healthy, but it's never too late. So those are the things I wanted to leave you with. There's a couple of resources. Just 2 weeks ago, I read this wonderful article by a lawyer in Harrisburg, Pennsylvania. It was published in the Journal of the National Academy of Law Attorneys. I was a founder in the mid 80s. And it's a Bible for those people who are professionals. Most of you family caregivers are going to be very bored, but it tells you every law in the United States that's good, that's bad about caregiving. And it's a great resource for those of you who are professionals, social workers, physicians, whatever, lawyers. And that's the online reference to it. And then we have a webinar on our website at the law firm, and that's the second video, which goes into a lot of the more specific details than we were able to do tonight. So with that, and a reminder to sign up for next week to see Sam's whole play. It's an hour, and then I'm going to moderate I guess they call it a talk back, where Sam and Susan are going to talk about caregiving from his perspective and also from Susan's perspective as the recipient of his love and caring. So with that, Beth, if we have any questions, you can interrupt and read them. But do we, or shall I ask a couple now? We have a little time.
No specific questions, but really nice feedback from our attendees.
Okay, well, let me ask the panel a question. A number of years ago, I was chair of a subcommittee of the New York Business Group on Health. And on my committee, I had a lot of very senior executives in major American corporations based in New York. And most of those corporations had employee assistance programs. They're supposed to be helping people in time of need, physical, emotional, psychological. None of them had anything to say about caregiving. Most of them would give a piece of paper to the employee with a list of organizations they could call or online help. Why was that? Greg, you're in the corporate world. Why didn't they do more, or don't they do more, other than EmblemHealth?
Because too long, the caregiver, as I said in my opening remarks, has been the silent patient. People were focused upon information about a disease specific. That was all very exciting, and people put their focus, their corporations put their money and focus there. And therefore, they never got to the caregiver. And this was the gift that Emblem had. They said healthcare is a three-legged stool. There are endless medical journals that talk of that. And they simply said, we haven't paid attention to that care recipient. As we have now begun going into other corporations and doing what we've been doing within EmblemHealth, because at the very beginning, they said to me, your focus needs to be on the employees, our members, and the world at large. Well, I travel the world now, and after 22 years, we're taking Emblem's story all over the world. And there is a simple 8-part series that I did entitled You Are Not Alone. It's 8 to 10 minutes each one, very short, but it's Caregiving 101. And I have based classes on it all over. And we have begun taking that. Sheila's been part of it. We've started an organization with Emblem support called the New York City Partnership for Family Caregiving Corps, which is taking caregiving into the corporations, where I'm doing programs like Coffee and Caregiving, where we do a support group together. And they are some of the most powerful because they allow people to be their full self. Because these wonderful employees who are working 8, 10, 12 hours a day, they go home to another job that's 24/7.
So Greg, when I was running this committee at the New York Business Group on Health, we ran some support groups. And what astounded me was that of the 15 people in the room on a particular evening, talking about the problems of illness in their family, most of them didn't define themselves as a caregiver.
Right.
Absolutely.
Is that true?
Totally.
Why
People,
is that?
Because, well, one of the reasons is I honestly think people of faith think I'm supposed to do that. And I do agree with that. However, you need to define it. That is why we do, Sheila does so many programs. Sam has contributed in a very special way. Sam has added because it's a very special type of caregiving. For a long time, and I have to admit, when I was first asked to be do the program for Emblem, and they said caregiving, I thought about my grandparents, all of whom were dead. But it's not just the seniors, it's the seniors caring for the grandchildren. It is people with end-of-life issues in the middle life, with chronic conditions, and it goes on and on and on and on. And we do whole programs just on that. And so it's helping people to see that we aren't just talking, because I've now become the old person that I was thinking of when I was invited to care to create this program. And I'm very grateful for caregivers, but there are many levels. Sheila, I know you want to get in on.
Yeah, and Sam has his hand up too. Sheila?
I just want to say that when I became a caregiver, it never occurred to me to ask for help. I never thought, well, of course, there was nothing for caregivers, but I think you're so overwhelmed being a caregiver that it's just, and in fact, sometimes the hardest people to convince to accept help are the caregiver and the care recipient. That's a biggie for any organization trying to help caregivers. But
Are the caregivers who are employed afraid of being fired?
There was a wonderful, Greg, I just have to tell them about, we went out to do the program with Emblem, the CORE, New York City Partnership for Family Caregiving Corps, that was Greg's brainchild, of which I'm very proud to be part of. But we were speaking at a small company, and what happened that was really astonishing and moving was everybody knew everybody in this little company, but they came in to listen to us do our spiels. And at the end of it, this one woman started talking about how she was her mother's caregiver. And the woman next to her said, "What do you mean? I didn't know that you were caregiving for her. My God, I'll do anything for you. I'll go food shopping. I'll help you. I just had no idea that this was what was going on, and they were sitting next to one another. It was quite startling.
If I could jump in, because I think my experience and what is that I mean, that was exactly what you said, Greg, and Sheila, is I didn't see myself as that. You don't think of it. You're a spouse. Now, mine is the spouse, but if you have a parent, you have a child, it could be a sibling, and you depending on the relationship. But mine, as a spouse particularly, it's what you're supposed to do, right? It's not, of course you're going to do this, and you rearrange your life without thinking that you're doing anything. In fact, you worry maybe you're not doing enough, that what you're supposed to do, maybe you're not being enough. But it is, so an awareness of the role and helping people come to terms with the idea that they should be open to quote help or learning is a part of the challenge. I'm sure you're both involved in it, that family, whether again, it could be a sister, it could be anybody said, no, it's my job. I have to do, I wouldn't be good or a good husband or wife or a good child if I wouldn't do all this. The fact that it's all right to get help is, I'm sure, a big message. One last thing on the corporate side. I was invited once, and if there are any corporate people on the line, I prefer the HR department at a bank in New York, and I'm not going to remember, had me come in and do the play as an employee benefit to at least be able to hear and see it. And again, it's another way. There's not any one way, but ways for people to see and register about the journey that they may be involved in.
Is the failure of not asking for help a result of some societal creation of shame about having a medical problem in the family?
Peter, one of the things to answer your question has been corporations will often and for a very long time say, don't bring your private life into the corporation. Only recently have we had employee resource groups. Emblem has led that way. We have one for women. We have for the African-American community. We have it for the LGBT community, where we invite people to be their full, authentic self. But for so long in family caregiving, people would need time, and we've certainly learned with COVID.
They were afraid.
They were afraid, and people would not say that they were caregiving because they were afraid that they weren't that perfect corporate person. I mean, my favorite, one of the things I do is counsel. I have done thousands and thousands of counseling during the last 2 years on death, dying, and grief. It has been just overwhelming with people with Emblem and elsewhere. But these were topics that people had never talked about before. They weren't given permission. Permission is something that's terribly important in this country. And thanks to Mrs. Carter, she started getting that word out there. Betty Ford started to do it with alcoholism. But it takes people who are willing to stand up and say, this is my story. And that's why it is so marvelous what Sam is doing, what Sheila has been doing. I am honored, and there are some other wonderful people watching this broadcast, because I've been reading some of the chats, who have had incredible stories in their life. And they said, in my life, I couldn't find this resource. So they started it. They did something. And now the gift is that as people are allowed to be who they are, it's not an excuse, but rather it's an empowerment.
Well, we are basically out of time tonight, but I want to pick up on what you just said, Greg. The three of you have helped people to accept and acknowledge that they're caregivers and ask for help. And the concepts here tonight, we just touched on it. Sheila, your work is remarkable, and I'm thrilled that it's being replicated around the country. And Sam, you're getting people to think about it too. And Greg, your work I've known about for years. So I want to thank everybody who has watched tonight, and I hope you will sign up for next week, a week from tonight, but you will be fascinated by the play. And then we're going to have a little talk back, and maybe Sam will tell us a little more of the depths of his soul. So thank you all, and thank JALBCA for doing this, and Beth, of course, my able marketing assistant at the firm. We've been thrilled to support this, and I hope the listeners, the the watchers, I guess.
Peter, there is a strain in the chat real quick, because I'm delving in this a little bit myself.
I haven't seen them, so go ahead.
Well, no, it is about the caregiver and with somebody who has a form of dementia. And we're working with that a lot. I'm engaged in that process a little bit. And I don't have a good answer. I know it is a uniquely challenging moment. I would just add, but I've been working, there's something called Dementia Friendly America. It comes out of Dementia Friendly Europe. The Cleveland Clinic in Nevada has a great program, but you can Google Dementia Friendly. And a couple of quick things is treating that person with respect and dignity, and understanding they may know more than what you imagine. And as the lessons you heard today, both Sheila and Greg, get yourself some help as well, but assume it is a very challenging caregiving experience.
And Peter, thank you so much for making this possible for all three of us. We love being together, and we were honored to be with you.
You're a great team. We should take this show on the road. Sheila?
Yes, I just wanted to say that I think the most important thing when your loved one or friend or whomever has dementia, that you do get training from, the Alzheimer's Association or in kind or someplace, because that's critical. But in terms of share the care, you can still have share the care, only we have a way of working it so it's a very small group surrounded by a bigger group that never comes into the house, so that because you're working with a specific condition, we've worked out ways for share the care to address those needs.
Well, all right, it is time. And if anybody wants to send in questions to any of the speakers, they will respond. And to me, if you have any questions about the comments I made, we'd be happy to respond by email or text. And I look forward to seeing you all next Wednesday night at 6 p.m. Good night, everyone.
Thank you, everybody.
Good night.
Thank you, Peter.